So the topic today is meniscus tear, when to excise, when to repair. So we start with some basic anatomy again, as I usually do. So the medial meniscus is C-shaped and triangular in cross section, and it covers about 64% of tibial plateau. So the coverage is how much of the plateau is covered. So almost 64% is being covered. The width would be around 10 millimeters. The lateral meniscus is more circular. It covers lateral plateau more, and the width is higher, about 12 to 13 millimeters. And it's a fibrocartilaginous structure made up of mainly collagen type 1. Remainder is 2, 3, 5, and 6. The fibers are arranged in two patterns. One is the circumferential pattern, which is made in the periphery. And as you go medially, you have the radial fibers as well. So inner two-third is a combination of radial and circumferential fibers. And the outer one-third is mainly circumferential fibers. And the vascular supply, this is the main thing about meniscus, that the vascular supply is coming from the periphery, from the capsular area through perimeniscal capillary plexus. This is what supplies the blood supply to the meniscus, and it's only up to the 1/3, which is the vascular part. About 10 to 30% of medial meniscus and 10 to 25% of lateral meniscus is vascular. This is the red zone. This is the main zone which is vascular and which will be amenable to repair. So repair will always be in the vascular zone, the red or the red-white zone. This is what I'm talking about. The outer 1/3 of the meniscal part is vascular and which is amenable to repair. Beyond that, it's very controversial to repair tear in the white zone.